Hey everyone, I'm Jen, and I own a veterinary technician relief business.
And I'm Michelle. I own a veterinary technician mobile house call business.
And you are
And you are
listening
listening
to
to
Endless
Endless
Journeys,
Journeys,
the Vet
the
Tech
Vet Tech
Odyssey
Odyssey
podcast.
podcast.
In this podcast, we will be discussing and meeting with credentialed technicians who have created their own path with business ownership within the veterinary space.
Our goal is to help inspire burnt out vet techs before they leave the industry altogether through our stories and the stories of other vet tech business owners.
Hi! Happy Monday!
Happy Monday. How is everybody doing today, Jen? Happy Monday evening now. Again.
When this episode comes out, it will be sometime in January.
End of
But
January.
we're recording mid-November right
Yep.
now. So, and then this episode, we are going to be interviewing Emily Piché today.
Yay.
And so we're going to talk to her later in this episode about what she's doing for hospice care right now for a lot of our senior patients and for our pet parents. And so that's something that we're going to be talking about later in this episode. But right now, we're just going to go over our normal segments of the week that we normally do.
Yeah. So I had a few things I want to tell you, Jen. I had a few stories from this week I want to tell you. One that I think you're going to appreciate.
Okay.
And so I don't know what order our episodes come out in sometimes, but the last episode I told you about Bronson was going for his yearly DCM monitoring. He's a 5-year-old Doberman, so poster child for that. And for the past 4 years, nothing's ever popped up. I wasn't expecting something to pop up.
Oh, yeah.
Something
Okay. So
good.
the last episode that we recorded, you talked about, you did the halter for him.
Yeah, we got
Okay.
the results. Yep. So we got the
Oh, okay.
results. Yeah. So I have no cardiology background. So I came on here as the owner, and as an owner who's no longer in the direct industry, is like 1 year and out the other kind of. But we did find something really suspicious. And according to my cardiologist, it raised the hair on the back of her neck. But he had these clusters of pre-ventricular contractions.
Oh.
Yeah. So she noticed that it happened all within like the same little time period and in clusters, which I guess she didn't like that part. And it happened at 5 a.m. and we're assuming he's sleeping. It didn't happen when he got himself worked up over the dogs on the TV. It didn't happen when he got himself worked up over the dogs walking by the window. It happened at 5 a.m. in the morning when he was sleeping. So
Just the
she's
one
not
time?
like there was I think a total of 24, but I think like 8 of them happened all within one, cluster. And then another 4 happened in another cluster. And then the rest of them were within I want to say like the 24 hours, I want to say.
Oh.
So again, pet owner hearing something bad goes on, some of it when in one ear and out the other, but I wrote
Uh-huh.
the important notes down, like as
Okay.
she was talking. I was like, okay. But she's not diagnosing with DCM. Instead of doing a halter in another 12 months, so every 12 months we do an ultrasound and a 48-hour halter,
Mm-hmm.
we're going to repeat the halter only in 6 months. So I'm like, okay, no, at least she didn't want it in 4 months, right? Because that would indicate to me that she's a little bit more worried.
Right.
She didn't want it in 90 days or a month, which would make me worry.
Mm-hmm.
6 months sounds like we're watching it. We're concerned. I'm trying to put myself as a technician in her head and step out of pet owner visions right now, because right now I got my blinders on. So that's the way I'm trying to think about it. And she also said in 6 months when we do the halter, we do not need to do an ultrasound. And it's going to be a tech exam. So I don't know if she's going to examine him or not. It sounds like she's not, which I'm like, cool. I'm okay with that, because that means you feel confident that this is, So yeah, we're preparing.
Okay. So
you know.
she told you that she wasn't sure what it was necessarily or what the cause is
Yeah.
at this point in time, but that
Yeah.
she's concerned?
Yeah. So we don't know like the
Oh.
cause or the what or the whatever. Like we don't know, especially since it didn't happen during like a time where you think it would happen where he's, woo wooing at the TV.
Mhm.
So that's why we're like, hmm. So
Ugh.
I myself as a pet owner, I'm like, let's do the halter in 5 months. So I'm gonna try to like shimmy myself in there at 5 months just to get my answer sooner. I'm worried about my buddy, but
Yeah.
if she's cool and laid back about it, I'm gonna be cool and laid back about it.
Well, I feel like sometimes it's so much more difficult when these things are happening and they don't really have an answer for you either.
Yeah.
Because they're just like, I don't know. I don't know yet, but I just know that I'm concerned. And you're like, okay, well, that's not great to hear. Because at
Yeah.
least if there was like a reason or a diagnosis, or there was just, or, something that you could kind of just like hang on to, and then
Yeah.
you would know. But right now, it sounds like you're in the unknown
A little bit
for the next
unknown.
6 months.
Yes, unknown, but unknown with a plan. I know what I'm doing is right, and I know that I'm doing everything within my power, not only as an informed veterinary technician, but as a pet owner,
Hmm.
to make sure that I'm taking care of my dog.
Yeah.
And I'm doing everything. Like her technician also has her VTS in cardiology. Her technician has done conferences here in Michigan, like our local mission conference. Like she's done lectures on it. So I know I have my dog in like the best hands possible. So I just keep reminding myself that because I absolutely trust my cardiology team. They're privately owned. They're not the big chocolate, which is why I love them even more. And I guide a team. So we're just going to roll with it. But
Yeah.
I will, of course, let you know in 6 months what she says.
Okay.
Um, he's my chief of security. He's my tax write off. He's my buddy. So I love that damn dog. He's a pain in the ass, but God, I love him. So
Yeah.
I just want him around for a long time.
Well, and I
Yeah.
mean, that was the whole reason why you did this, right? I mean, and that's what we talked about in the last episode, that this is for preventative. And at least whatever it is, like you caught it early and now you
Yeah.
can just go from there. But it still sucks. You still
Yeah.
don't want to hear that.
No, you don't. But I figured, you know what? I thought about this long and hard. And in that last episode, I remember I told you about that other Doberman where I
Hmm.
tried like hell to educate that owner, be like, this is why you need to do this. And she's
Yeah.
like, I would know if my dog's sick. Like,
Right.
just so cocky and arrogant that she would know. And then
You don't.
8 months later, her dog keeled over and died in a traumatic way on Thanksgiving. Well, you know what?
Yeah.
Maybe if she would have taken my freaking advice and not been so arrogant as to my dog is healthy because it eats and it wags its tail, dog would not have had a traumatic death.
Yeah.
Maybe she would not have had to experience that. So I believe I'm one of those people like everything should serve a purpose, like good, bad, teaching moment. And moving on to any other animals that I see that are a breed that is predisposed to DCM, and I know the owner is not monitoring them, like Cavaliers, Boxers, Dobermans. I'm going to let that Doberman and Bronson be the examples of why we should be doing this. Because Bronson on the outside is happy, healthy, he's barking, but something underneath is knocking at the door. And the only reason why I was able to find that is because I did gold standard medicine with my dog and I did routine screening. And this is why, because now I can make a plan for Bronson. I can
Right.
extend his life. I can make him more comfortable. You're not going to catch me saying, oh shit, my dog can't breathe
Right.
on Thanksgiving and then, having to make these massive decisions after everything's thrown at you. I can plan. I can figure
Hmm.
out, we can keep an eye on this thing. So Bronson and that other Doberman are going to now be combined into a teaching lesson for my owners whenever I see these pets that are predisposed to it, because I'm going to let at least their lives have some meaning. And
Yeah.
do you want to be Bronson or do you want to be the other dog?
Right.
Like, go get screened for DCM. So I'm going to turn negative into positive.
Yeah.
Mm-hmm.
Oh my gosh. I'm sorry.
Yeah, it's okay. If you ask Bronson, he's just chilling out there right now, probably with Alex.
Yeah.
He's still living
There
his
was
best life.
there was one thing that I always remembered, one of my doctors said, because I was so upset about like my 8-year-old golden retriever dying at 8 from cancer. And I was so sad. And I was like, he's just so young. Like he's
Yeah.
like he's just so young and he deserved a longer life than that. And I remember when my
Yeah.
doctor said, he doesn't know that though. Like to him, that was his life. And he had a good life up until the day that he died. And that's all that he knows.
Yep.
Like he doesn't know that his life was short. He just knows that that was his life and that he loved you and knew that you loved him. And that's all that we can do for them sometimes at the end of the day. There's so many things that hurt us sometimes and that we think about that isn't fair, but to them, they're just, every day's a gift to them.
Yeah,
So,
that's right. And that I never heard that, and thank you for putting that in perspective. Yeah, he doesn't know he's young and has more life, and I'm sure he's got plenty of years.
mhm.
But no, you're right. They're not like us. We're like, gee, we're only 3 and we're so young. Like dogs don't think that way, and all they know is they've had a loving, beautiful life.
Right.
And I thank you for telling me that because I genuinely needed to hear that, and nobody's told me that yet.
It was definitely comforting because they don't think the same way we do and they don't think because that is the things that we think like, oh my gosh, they're so young, like there's all these things, but it's like they just know that every day they get to wake up with us and they love us and they get to like do the things that they love to do with us and that's what makes them happy at the
Yeah.
end of the day.
Yeah.
Every day they live their life to the fullest and they'll always think that way.
The cardiologist told me that he is still to resume normal life. He can go to work with me. He can go to daycare. Like, so he's in, ignorant bliss right now. Bronson has no
Yeah.
idea. He's having a good old life.
Yep.
I'm worrying.
Yep.
He's fine.
Yeah. Yep, that's our job. Our job
Yep.
is to be the warriors, and they just get to, yeah, live blissfully ignorant. Hopefully, we'll find out more in 6 months, and hopefully it won't be any worse with the plan that you guys have.
Yes. And if I have anything to do with it, it'll be 5 months because I'm going to try to get on that schedule a bit faster so my anxiety will stop racing.
Nice.
Yeah.
Yeah. Yeah.
So what else we got going on this week? On a happy note, I onboarded 7 new clients and 5 of them rebooked. So yay! So hopefully I got
Wow.
5. Yeah, 7. I onboarded 7 clients and 5 rebooked. So I'm like, that's good. So that'll be 5 new clients are onto my 4-week rotation. So I needed that one.
Nice.
Yeah.
Yay.
Yay, new clients. Yeah, and they're all like really nice, cool. Like they're just a good batch. I'm like, oh,
Oh, good.
yeah. I was like, I'll take it. So yeah, it filled up. I had some holes in some of my routes that I wanted to fill up, and I managed to get them filled up. So I'm happy with that. Yes.
Nice.
All right. What else do we have going on this week, Jen?
We had a highlight. Well, it was kind of a little, I don't know, sometimes like it was kind of a little light in some people's eyes maybe, but it also kind of was a highlight. We had this poor little neonate that came in and it was like, I know it was like a large breed neonate because I think it was only like a couple days old, but it was really big. And it came in as a stat and it was really struggling to breathe. Pretty sure the doctor had done a diagnosis of like most likely aspiration pneumonia, but it was
Okay.
really, really bad. Like it was like we thought it was agonal when it came in. And we immediately put it on oxygen and the owners wanted to euthanize it right away and they wanted to be present. So we attempted to place an IV catheter. And I attempted to place an IV catheter because it was so big already. I was like, okay, I'll attempt a cephalic. So I attempted a cephalic, but I really just was not getting I wasn't getting a good flash on it. And then I believe I had another one of my LVTs try the other cephalic. And we were just trying to get an IV catheter placed in this little thing just so that the owners could be present for euthanasia. And then finally, it just like, and again, like I've had a lot of brain fog the past couple weeks. There's just, I've been doing my best at work, but I finally just had like this epiphany where I was just like, well, fuck it. Why don't we just do a jug catheter? It's a freaking neonate. And so I immediately was just like, okay, we're just doing a jug. And I just started shaving for the jugular catheter and like immediately placed it. And obviously, like my first thought wasn't jugular as well because he was gasping for air. Obviously, he was having trouble. So it's not like super ideal in my head to be like, oh, yeah, let's place a jugular catheter and then we're going to wrap gauze around its neck You know what I
Oh,
mean?
yeah.
So, like, that was also a reason why I didn't go straight for a jug, but at that point in time, we were just like, "We the owner just wants to be present, and, like, we just need to get this poor thing out of its misery." So I placed a jugular catheter, bandaged it up really quickly, and then, the owner was able to be present for that euthanasia. So, yeah, that was kind of like a little highlight for me because I've only placed, like, a handful of jug catheters in neonates. It's not something that I have done very often. But I that was like a little moment for me where I was like, "Oh, look at me. Look what I did."
Look at me go.
Yeah. So that was like a highlight from I don't even know what week that was. Like, honestly, I could not tell you. But that was a highlight where I was like, "Oh man, look at me." And then I completely forgot about it, obviously. So,
But it comes right to you, you're like, "Oh, yeah, that was a good moment."
yeah, I know it just like randomly popped up in my head. I don't even know what I was doing. And I was like, "Why didn't I talk about that?" um But yeah. And then this week I worked, I think, yeah, I only worked 1 day, maybe 2 days this week
Okay.
at one of my clinics. But yeah, not too much going on. I can't really think too much of like anything super exciting. Just like it's right now, it's just kind of like we're in limbo. It's really hit or miss sometimes of when we're really busy. And now I'm not working the late swing shifts anymore. I'm working like more of the early swing shifts. So like in the mornings, there's really not too much going on.
That
Um,
makes sense. Okay.
but yeah, yeah, we've been slowly, I think, getting busy. But also, I'm just taking a little bit of a break right now of just working too much. But I am getting on the up and up. So I just made my schedule for December and hoping that I can kind of still keep up with at least 1 or 2 days a week. But yeah, I'm getting my energy back and I'm starting to feel a lot better.
Love it. You have such a fire, so yes, the fire is returning. I'll take it.
Yeah, 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 it's returning. Hopefully,
Yes.
it took a while, but we're getting there.
Yeah. It doesn't surprise me that you're saying you're coming in like you guys are a little bit slow right now. I mean, again, you're going from nights to days in emergency, but I have been seeing a lot of technicians in the group saying that their work is slowing down. They're not bringing in as many clients. Like, I think the economy right now is really starting to do that tick, and I think
Yeah,
unfortunately we're getting a little impacted ourselves. Do I buy groceries or do I buy my dog the Bordetella vaccine? Like, I think that's where
yeah.
we're at. And then, no, do I buy groceries or is my dog's ear really infected? Or because I would imagine, like, with ER, it's like my dog got hit by a car. Yes, I'm really taking them in versus like.
Yeah, we actually, I will say a couple weeks ago, we had a really sad case where it was a bloat dog. It was a 9-month-old bloat puppy. And it was the worst GDV bloat I've ever seen in my entire life. I've never seen a dog come in that bloated. It is a poor little 9-month-old puppy. Ugh, that was such a tough case. Oh my gosh.
Oh,
Even just thinking about it, it's just like, oh my gosh. And we had to trocar it because the owner had, like, no money, like, nothing, and so we were hoping, like, "Okay, well, if we don't have any money, like, hopefully he'll decide to euthanize." Well, he was trying to come up with money. It took him almost 2 hours to come up with the money, and during that entire time, we were still getting air out of that dog.
oh, wow.
And he finally, like, they couldn't come up with any money. I believe he was in the military and his wife was also in the military, and they didn't have any money because of the government shutdown. And we ended up having to euthanize that puppy. And oh, that was a tough one. Oh my gosh, that
Oh,
was like, so yeah,
yes.
unfortunately, we are starting to see a lot of cases like that. I think even just this week too, I had another stat. It was a blocked kitty where, like, same thing, owner did not approve, like, owner did not approve emergency stabilization, and it was a DNR, but the cat was blocked, and at the same time, he also even though he did not approve any of that, he said that he was gonna figure out how to get money to unblock this cat. This cat was dying. This cat, I mean, if people have seen blocked cats where they come in, they're lateral,
Ugh.
they're like they're almost dysphoric, like, you already know, like, they're probably
I've seen a few.
hyperkalemic, and so, even though it was I mean, when we get cases like that and they say they do not approve emergency stabilization, I'm that person that I'm like, "I'm still gonna place an IV catheter." because if they're not going to approve emergency stabilization in a patient like this, then we at least need like a euthanasia catheter. Like, we
Yeah.
got to do something. So
Makes
I
sense.
always still place an IV catheter, and I'm pretty sure, like, while this guy was trying to figure it out, like, we still tried to unblock this cat, like, just with a tomcat, just to give it some relief. Like, we
Mhm.
still gave it, um, and then I think we still gave it pain medication, and um, we did the albuterol inhalant, that is just supposed to, um, lower that hyperkalemia. Like, we did all those things even though this guy had, like, no money. Because it's like, what are you gonna
That's so
do?
kind of you.
Like, you
Yeah.
can't watch them suffer.
Suffer.
Like, you have to get them comfortable, because if the owner declines that, but then the owner also tells you at the same time, like, "But we're gonna get the money," it's like, okay, well, we got to do something to help
Yeah,
keep this patient as comfortable as possible. And that
I
was like
would.
the same thing we did with that puppy, like freaking waiting an hour and a half to 2 hours for them to figure out the money, like trying to keep this patient warm. Like, we ended up giving it boluses. Like, they had no money. And so, like,
Yeah.
those are like the situations that we have to be in sometimes, where even though they don't have any money, it's like, come on, what are we going to do? Like, we're not going to just watch, like, sit here and watch them suffer.
Yeah. No, I think that is I love the fact that you guys are at least doing something to give them relief. You know what I mean? Like I got a feeling a lot of other clinics that are emergency and critical care may have their hands tied a little bit with that sort of autonomy over making decisions without the funds up front. But at least you guys were able to do something to make that poor cat comfortable in its last dying moments.
Yeah, and I don't know, like, if maybe, like, corporations are maybe a little bit more strict on things like that, and, I mean, I just know, like, sometimes, like, I know sometimes I've made decisions where I've literally been like, "Let them fire me. Like, freaking fire me. I don't care."
Yeah. Yeah.
Because it's kinda just like, I'm at least at the end of the day, I know that I made this decision, for the betterment of my patient.
Yeah.
And thankfully, like, I've never been scolded or been told that I made the wrong decision or anything like that. But I'm sure that maybe in the past there have been clinics that have done that to their technicians. And it just, I mean, those situations suck. But I think at the end of the day, even if you do get in trouble for something like that, I, I can always stand on my morals and my integrity and say,
Mhm.
at least I know that I did what was best for my patient at the end of the day. And if I'm going to get fired over that, then fire me.
Yeah. No, I would walk out with my head held high.
Mhm.
I absolutely would. I'd be like, "You fired me because I helped an animal even though the owner didn't have money? Cool. All right, I'm out." You know, I'm gonna frame that letter of you firing me too. I'm gonna put that on my mantle on display. Like,
Yeah.
that would be my level of fire me.
Yeah. Yeah.
Mhm.
So, so yeah, difficulties like that, but it also it builds your character and it builds you up as a technician as well in the job. I mean, then that's just saying that, our jobs are not black and white.
No.
Sometimes you have to just do what's right for your patient.
Jen, we got a good review this week. Did you Yeah, I loved it. The one on Spotify?
Yeah, we got a comment on Spotify on one of our Chill and Spill episodes. I believe it was the unlicensed versus imposter nurse Chill and Spill episode.
Yes.
It was from Kayla on that Chill and Spill episode. And she says, I always felt like I was the only one who felt frustrated with all of this, only because it meant so much to me and the pride I have with holding my license. But yet it never seemed to be of the same value to anyone else like I thought that it would. I dealt with being overlooked in my skills/knowledge by having someone far less experienced than I training other assistants, as well as being undervalued and pushing me out of exam rooms and off of patient care only to wrap packs.
Mm.
That's exactly why we made that episode, because of that frustration. So it's awesome that Kayla wrote that comment on there. Also, just kind of reiterating the fact of she felt like she was the only one who felt that way. And you almost feel a little bit alone in that. And I think a lot of times we as licensed technicians, sometimes we feel a little bit shameful for having that pride. And that's not fair, because we should be proud of our license and we should be proud of being able to practice at a certain scope and knowing how to do things. And I think that sometimes when you are a licensed professional and then you're not really given the opportunities of like monitoring anesthesia or placing central lines or placing PIC lines or doing those really those big things that licensed technicians are taught how to do in school. And then yeah, you are wrapping packs. I mean, not that doing those other things are lower tasks, but when you know that you could be doing more with your
Yes.
license and with knowledge, right? And I think that you definitely aren't alone in that.
No.
Kayla. I think a lot of people feel that way, and that's exactly why we're trying to do what we're doing here, and that if these clinics are not giving you those opportunities, then you need to go out there and you need to find clinics that number
Yes.
one are giving you opportunities, and you need to find those clinics that are looking for licensed technicians specifically and respecting the license because if you are working for clinics that don't respect the license, then you are not gonna get what you're looking for.
Mm-mm.
And I know that it's hard, and I know personally too, sometimes I don't know where you're located, Kayla, or if maybe you have started your own business already and maybe you're not even in the clinics anymore. But, I come from North Idaho, where the licensing is not respected in Idaho, so assistants are able to do the exact same thing that licensed technicians are, and it's not respected. But that's why I do a lot of my work in Washington. I live very close to the Washington border, and they do respect it. And just the amount of difference of, what you're allowed to do and the respect that you get, it's it's like night and day. So there are clinics out there that are looking for licensed technicians.
Mm-hmm.
It is becoming more it's becoming more of a thing. More clinics are now looking for licensed technicians. It is happening. It's slow going. So
Yeah.
we hear you. That's I mean, I know that I felt that way before.
Yes.
So
I the same. I will tell you this, Kayla. Somebody had told this to me a while ago, and I heard it somewhere. A clinic is more likely to change you than you are it. I wish I would have heard that earlier on in my clinical life, but keep that in mind. And I will tell you this. Sometimes it is absolutely just some strange, weird clinic protocol. My very last clinic that I worked at would not let anybody intubate except for the DVMs. Like, not
wow.
even not even the best, highest skilled technician could intubate, and that was put in place well before I came along, and I'm sure it's still the same way. Who knows? Maybe they changed it, but all of us who worked there were seasoned, licensed veterinary technicians. I think we did have a couple assistants, and we were okay with that. It's like it was just it was nothing against any one of us. It was just some sort of weird, whacked out rule. But then I think it was my third clinic I ever worked at. Like, I still, to this day, question the legalities of some of the stuff some of the technicians were doing because they were practicing at the very, very, very top of their license. I mean, I felt uncomfortable there because I was a new graduate. That's just my point of view. And I was scared to do a lot of stuff, which is why I think I fell in love with vaccines because they were simple in a scary place. But there are some clinics that will stretch you to your license as well, like
Mhm.
what Jen's doing. I mean, she's absolutely at the top of her license. So you might have to look at finding a place that's going to, like Jen said, that's going to respect your license and let you do what you want to do. And one of the red flags, like Jen said, find a place that's hiring a licensed veterinary technician. If you see an ad that says hiring a technician slash assistant, that's always a red flag because that
Mhm.
that that tells me that they're just gonna, take whatever they can get for the best price for the highest skills, and they're gonna go with it versus like, ooh, this is a licensed tech. Not to say that techs are licensed techs are, I'm not going down that road, but I'm just saying somebody's going to let you work at the top of your license and what you want to do as well. So I feel it's also appropriate to go into a clinic and be like, this is what I want to do. I want to be in surgery. I want to be in dentistry. Or, hi, I'm Michelle. Can I do all your vaccine appointments? I promise I'll bring you in good revenue. Like, we all can go into these interviews and let them know what we expect out of them and see what they expect of us and hopefully find a common ground. And like Jen said, start your own business. I mean, if that would, Jen does exclusively ER for the most part, but if you're happy in GP, we'll be glad to help you in whatever way you can just to get to the point where you can pick your own clinics like Jen does and just kind of float around and kind of date everybody and not marry any clinic and just kind of, pick and choose. Like, do that. And that could also be another avenue. Don't let that place hamper your license and your ability.
Right. And also if and then we've had this conversation before too in other episodes, but if you don't feel like you're getting utilized, but you also feel like you're not getting the opportunity and maybe you're not that comfortable doing those things too because you're not being given the opportunity, like that's when sometimes you're just going to have to go on your own time and try to learn. Because I mean, obviously, we've all been to school, like we're all licensed here, but you still don't get that comfortability until you start really delving into
Hmm.
specifically of what you're wanting to do. And so that's what CE is for. And even just like collaborating with your colleagues, if you know somebody who's really comfortable in anesthesia, but maybe you're not super comfortable and they're also not giving you the opportunity, so you're not growing, then you go and you like sometimes you just have to push and you have to find that person and you have to say, look, this is what I want to do. I want to be utilized more. And sometimes even being pushy like that will help you open up those avenues as well. So, you are the person that's going to make those opportunities happen. You can't let other people just dictate what your opportunities are going to be. And sometimes that's something that you have to do for yourself as well.
Great advice. Yes. Kayla, if you listen to this, if you have any questions, the email is always in our bio.
Mhm.
Let us know if there's anything we can do to help you.
Yeah, thanks again for the
Yeah.
comment. We love the
Thanks.
comments. We
Yes.
love hearing that. So, yeah, keep them coming. Right. And so I'm going to let you take on the salute of the
Salute.
week, Michelle.
I love these salute of the weeks. I think it's so cool that when we're in these groups, we see people who run their own business who do something amazing. And I've been catching them. And also, as you're starting to hear these episodes, if you're a relief technician, if you're a mobile vet tech, and you did something really cool, we want to give you a shout out. We want to make a community. We want to elevate all veterinary technician business owners. And this week, Jessica, she posted in the Unattached Vet Tech group, and I think this is so cool. She wrote, I'm so beyond happy that I was successfully able to do a home cat blood draw by myself for a senior panel, just with the owner comforting her kitty. She's very anxious, and I was nervous, but it didn't seem to show. Building my confidence that I can actually do my own thing just made when I read that, like, that made my day because a lot of us are doing nail trims and anal glands. So I want to see more technicians doing blood draws, doing more items that's in with the scope of our license
Or like
under the
blood
yeah.
pressure checks or even like blood sugar checks, to help for like glucometers and yeah, definitely
Ex-
more on that scope would be nice.
yes, I would love that. And I used to be really, really good at venipuncture back in my day. Oh, I loved it. I loved a good fat juicy vein. I haven't hit one since 2019 at this point. So I'm appreciating that very well. And
Yeah.
so, Jessica, hats off to you for doing an at-home blood draw on a kitty cat by
Yeah, that's a
yourself.
big deal.
That's impressive. That's very
Yeah,
impressive.
yeah,
Yeah, I had a very stressed out cat this week, and yeah, so having a cat like just be calm because cats are cats. I love them. I actually am more
yeah.
of a cat person than dog person, but cats are cats and they can be fractious. And a lot of times, us mobile techs know that when we walk into the home, like those cats, they scatter. Like they
Uh-huh.
hear somebody knocking on the door and they go hide under a bed, and they don't even know it's like somebody to come in to see them. It could be anybody, and that will always like set off a cat. And
Yeah.
at least for me, I have a rule about cats. All bedroom doors must be shut so that way they can't hide under the bed.
Mhm.
If you have a couch that's elevated, they can get under. You need to roll up some blankets and towels and pillows and stuff them under there because I am not lifting that damn couch. I am not crawling behind your Christmas decorations. And by the time I do, your cat's not going to let me touch them because they're going to be so stressed because I just done pulled them out of their safe spot. So to be able to perform that on a cat is so, so good. Like, I wanna hear more from you, Jessica, that you've been doing a lot more casting in your area.
Yeah,
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 okay.
definitely. Awesome. That's awesome.
Question of the week. Drum roll. Um,
Oh, yeah. Question of the week is our last segment before we do our official interview with Emily.
yes. So this one was also pulled from the Unattached Vet Tech group. Somebody had wrote, "How often do you guys raise your prices? I do mostly nail trims, sanitary shaves, anal glands, but a majority of my income comes from pet sitting. My husband's work has recently slowed down. I haven't raised them in 2 years," meaning her prices. "So
Mm.
I felt like it might be time." Yes, it is time, my dear. "When you do a price increase, how often do you do it and how much do you increase it?" I think this is a good question for both of us, right?
So I've only been doing this a year, and I felt like my prices were already pretty high. And my prices, what I had already set them at, I felt like I was already pretty much set, even with inflation. So I decided not to raise my prices this year. I did change my holiday rates. I doubled my holiday rates. That was the only big change that I did this year. I was planning on probably raising my prices next year. But this year, I had decided not to change my prices because they were already pretty high.
Okay.
And like I said, and just going over everything, and even with inflation, I was like, yeah, I think I'm still in the green. But I
Sure.
mean, I think that if you feel like you need to, and I mean, and she said she hasn't raised them in 2 years, so
That's
I'm
good.
on the same page with you where you're like, "Oh, not 2 years? Probably should then." And that's why I said, like, I probably will next year because then that'll be 2 years for me.
How often, Jen, do you think you're going to do it? Like, have you thought about that? Like, how often you plan on raising
I
your
was thinking
prices?
about every 1 to 2 years.
Okay. I think that's solid.
Yeah, and then, of course, just depending on, like you said, like, on inflation and how much money you're bringing in and where your setbacks are and, obviously if insurance goes up and things like that. So those are all things that need to be considered.
I have a lot of factors that go into mine. I started off very low because I wasn't, like Jen, where I was like, I'm going to start a business. So I was very low. Like I was too cheap. So I did raise my prices after my first year. I did a pretty hefty increase because I realized how low my prices were. And then I haven't done a price increase since then. However, I've made a few mistakes with that, and I want you to learn from my mistake. Number one, don't tell your clients your pricing. When you onboard them, write it down. So that way, when you do raise your prices, if your client's like, "Boy, you just raised your prices. It seems like you're always raising your prices." No, Mrs. Smith, I actually haven't raised them in a year since I've been seeing you. And make sure you put that in writing too, that you're now increasing your pricing. That way, when your clients, if they think that you're doing it too often, you can always defer back. I know another person in my area who owns a pet business. She does her increases every January. She'll post that on her social media that yearly increases are coming. And she always has this nice little professional spiel about it. I think what she does is great. I have some old school clients who are still grandfathered into like my OG prices. I have some clients that have been with me since day one. And I'm like, they have been with me when I didn't know like anything. I'm like, those are my ride or die. I'm like, they can continue paying those old school pricing because they never reschedule. They're pleasant. They're awesome. I don't want to do a price increase on them. Um, I have increased once for people that weren't so new, like, if somebody who came in after, like, my first year, they're a little bit higher, and then my newly onboarded clients pay the price now, but my goal is to get everybody at the same price. Like, I have, like, maybe 8 clients, under 10 clients for sure, that are on my OG pricing still. They're gonna be grandfathered in because they've been with me since the first month, but if their pet passed away, they get a new pet, I'm gonna put them on the new pricing because I want eventually at one point all my clients to be on the same price. So don't do that because I did that and sometimes I get confused. I'm like, "Which are you OG? Are you not OG?" And I'm like, "Whatever it is that you gave me last time, it's fine by me." I've done that so many times because I'm like, "At what point did I raise my price with this client?" So I've learned my lesson. Moving forward, I will be doing it once a year with everybody once I get everybody on the same plane, like price plane.
So, I have a question for you, Michelle, and this is something that I was trying to figure out too, is if I did do a price increase, would you do that by percentage or would you do it by dollar amount?
For me, I would do by dollar amount. That's just me because I feel like a percentage is always going to end up like, let's say $35.78. I don't want to deal with 78 cents. So I would just, round up to 38 or round down to 37. So
So do you
I,
do like when you do your price increase, do you do um, like 3% increase or 5% increase and then dollar amount it that way? Like, I think that that's something too that maybe we need to talk about a little bit with our price increases of like, how much should we increase them by sometimes? Like by $5, by
that's
a
what I did.
dollar?
Yeah. I did $5. So like all of my clients are within there's no client that have a greater price difference than $10. So I always did a dollar amount. If I were to do a percentage, I think with me being one of those types of people that would be like, there needs to be a reason. I need to have something that I can prove and
Mhm.
something I can show. If, let's say, the new stats come out for next year that says the price of inflation has gone up 12%, I'm going to increase my pricing by 12% and then probably explain that to my clients. Well, I went up 12%. That is because this year the inflation went by 12%. I got to be able to maintain my purchasing power.
You know?
All my fees are going up. So I'm going to go right up with the economy. That's how I probably would think about doing it. Just because I would not want my clients to think, I've just raised them so I can buy myself, you know, my second Equinox.
Right.
um, I would want them to know it's a tangible reason why I'm doing it.
Mhm.
Yeah.
One of her questions here, when you do a price increase, how much of an increase do you make it at? So that's definitely, I think, something that needs to be talked about a little bit because I think that can be confusing sometimes for people in business of, to say what's fair and what's not fair. And so, yeah, if you are talking to your clients and they have a question for you, you lay it out like that, saying this is my price increase, this is the reason for the price increase, and if you base it off of the inflation percentage, then they can either take it or leave it. And I know, sometimes uh I mean, there's always that risk, right? That when you increase your prices that you may lose people,
Hmm.
but I mean, it is needed in business, unfortunately.
It is. You're right. And if a few dollars is going to make or break you with a client, do you really want that client? I mean, that's what I asked myself when I did my price
Yeah,
increase.
because
It's like,
it can get a little bit scary.
yeah. And if you're going to lose one or two clients because, oh my God, she increased it by 9%, well, then, they're not the client for you. They don't respect you. Just let them go. All your clients will understand. They're going to want to support you. And if they don't, let them go because you don't want to deal with it down the road anyway. And my best friend actually was the one who told me that, so I'm not gonna take credit for that. Because when I was doing my first price increase, I was shaking in my boots, and her other good friend is a hairstylist who owns her own business, and when she did her first price increase, she did it purposely to weed out the clients that she didn't want,
Hmm,
and she called it, cutting the fat or trimming the fat because
yeah.
she didn't want those clients, and she knew if she increased her pricing, that was a good way to get rid of clients that she didn't want, and I was like, "Oh, that's pretty I'm still kind of blown away by that concept, but it makes sense after I've been in business now for a few years. So don't be too worried if you raise your prices. Yeah.
So I just want to put it out there to anybody who does relief and they're listening. I am curious when you guys do your price increases, how much do you guys do your price increase? Like, do you do it by a percentage? Do you do it by like a solid like $5, $10 amount? I'm curious, and just for myself, because it was something I thought about doing this year, and I just looked at my numbers, and I was just looking at the amount of jobs that I have done, and I was just kinda satisfied with where I was at this point in time and the money that I was making, and I just didn't think that it was needed this year, and like I said, the only really big change that I did was my holiday rates, and I had already decided that I was gonna do, uh, last year time and a half on actual holidays. I don't think I actually worked an actual holiday last year, but I worked holiday week. So this year, when I was making my contract, I had decided that no matter what, whether it was a holiday day or it was just within that holiday week, I was charging double the price. So
Yeah.
that's what I did. The jobs got accepted. I ended up having, unfortunately, to decline those jobs recently just because just because of things that were going on in my personal life at this point in time. But that was basically the only change. And I did tell uh, them on my contract that I was just going to decide not to do a price increase this year. But I am curious for when I start doing my price increase, like it is something I've thought about, like what is fair? Like just like 3% or 5% or things like that. So I think it's interesting, Michelle, saying that, you just base it off the inflation percentage. So that's definitely something that, me might think as well.
Yeah, because if you don't keep up with inflation, you're only going to lose your purchasing power. Like, so I feel like at least at the bare minimum, you keep up with inflation.
That makes sense.
So that actually reminds me, this beginning of this year, I actually did not do price increasing, and I actually let all my clients know that I wasn't going to do price increasing. But one thing I did in lieu of price increasing, because I know I had to be a little bit more profitable this year because of the economy, is I tightened up my routes. So if you're doing mobile work and if you have people on set routes, reevaluate your routes and see if you can't even shave off like 1 mile, 2 miles, that'll add up over time. So I did make that announcement at the beginning of the year that I was going to be changing my routes and tightening them up a bit. And I was doing that to avoid raising my prices because I did not want to raise my prices here because I know the economy was bad and I love my clients. So I just collectively worked with all my clients like, hey, I'm going to keep my pricing the same. Can you move your time slot over just a little bit? Or I know you're off during the entire week or you work at home. Do you mind if I move you to this date instead? I did a lot of that at the beginning of the year, and I feel like that really helped out immensely. So I actually did not raise my prices this year. If I can next year, we are coming up to next year actually. Um, we I don't know if I'm gonna raise my prices this year. I don't know. If I do, it'll just be my OG clients up to the current clients. That'll probably be my only price increase, is just getting those OG clients up. So that way everybody's on the same playing field. And then I might just retighten up my routes a little bit. So you can always do that as well. So just tighten up your routes and be more gas efficient. And then itself will help you out.
Yeah, no, that makes sense. I hope that was helpful information for her.
Yes.
All right. Well, I think that concludes our question of the week. If you have anything to add on to that, or if any of our listeners have anything to add on to that, like I said, just what what their strategies are for like price increases and things like that, I would love to hear them as well. So with that, we are going to move on and we are going to be speaking to Emily.
Yes, Emily, this is truly a really good episode. What she's doing is absolutely bringing in a whole new needed market into the veterinary industry. I think she's not only helping the technicians and the doctors, but she has helped thousands of aging pets get relief.
Mhm.
And that in itself is just beautiful, beautiful work to think of all the lives that she's impacted. So we're extremely honored to have Emily on for today, and I hope you guys are too.
Yeah, this is going to be a really good conversation. Yeah, stick around for the entire conversation. This woman is brilliant. Like, she was so much fun to talk to. Hello, everyone. We are here with Emily Piché, RVT. So, Emily Piché, RVT, CHPT, CPEP, is the founder and owner of The Art of Goodbye, a veterinary hospice and euthanasia training institute. She is a passionate care provider and educator who believes every veterinary clinic should offer tailored hospice services. She has contributed to the global conversation on this topic through international speaking engagements, workshops, and features in leading publications, including Vet Practice News magazine. Her journey began in 2018 when she helped launch one of Canada's first veterinary hospice centers, where she served as assistant medical director. In 2021, she became one of the first RVTs in Canada to provide in-home hospice and euthanasia services under indirect veterinary supervision. Since then, she has guided thousands of families through their pet's final chapter and educated hundreds of veterinary professionals. Emily lives on a hobby farm in Ontario with her children and animals. Well, welcome, Emily. We're so happy to have you today.
Thank you so much, ladies, for inviting me to join you on your podcast. I really appreciate it.
Yes, of
Yeah,
course.
we appreciate
Yes.
it so much. We always love it when everyone who has been on our podcast has just been willing to take the time and come on here and just have a really good conversation. And give us the insights of what it's like to, do what you're doing and to own a business.
Yes.
Absolutely.
Yes. Yes, especially yours. Yours, I mean, just generating through your bio, you've done so much with your career. It's super impressive and very inspiring to see how much you've built. And hopefully that this conversation will help other RVTs, LVTs, and CVTs, not only from Canada, but from the States as well, get inspired by some of the work that you have done.
Thank you. That's
Yes,
very
yes.
kind of you to say, and I'm just so passionate about this field and elevating other RVTs to expand the roles that they have and find a niche that brings them joy and happiness and fulfillment in their career.
Very much
And
so.
I also just want to say, I think Michelle I'm pretty sure this is our very first interview with someone outside of the States, correct?
Yes, that is correct. Yep.
Mhm.
Ah,
So,
woo
Yeah.
yeah, you're our first. And, me and Michelle also have kind of realized there's actually kind of a big difference. So that's something that I feel like I've just kind of started to learn a little bit more about how much more you guys are doing and are able to do without the indirect supervision of veterinarians. So I think that that's going to be a really interesting conversation piece today as well.
Yes.
Yeah,
Yeah.
absolutely. I'm hoping that eventually licensed veterinary technicians around the world are going to be able to expand the contribution that they can make so that we can increase access to care for the families that we serve.
Yeah. Yeah.
Absolutely.
Hmm.
Absolutely. Yes. That's what we're all trying to do is when we don't work at a clinic and we're, providing our services, we are absolutely providing access to care to some of these clients who otherwise wouldn't get it. Yes.
Absolutely.
Right. So, one of the first questions we love to ask our guests, just to get to know them, we feel like everybody, when they pick out their dog breeds, it kind of says a little bit about their personality. So, tell us, what type of dog breeds do you own? Are you a cat person or a reptile person? Like, what do you have for pets?
So I have a lot of pets, and my favorite dog breed is actually a bull mastiff.
Oh,
And my bull mastiff is no longer with me, but about a year and a half ago, I adopted a black lab.
Oh.
And she was 9 years old. She's a senior. You're going to notice a little trend with my pets. I'm passionate about seniors. And she was a working dog all her life. She was a gun dog. And so she was not a pet. And when she needed a home, it just kind of came across my radar. And I thought, you know what? I would love to give that little soul a good home. And so her name is Dee Dee. And I've had her 2 years. She's 11. She'll be 11. And she's a typical Labrador. She's like a food addict and always happy. So I've got my dog. I also have a cat she's about 13. Her name is Gracie. And I adopted her about a year and a half ago. She was actually scheduled for end of life care. And the
oh,
family had said that she was really vicious. And when the veterinarian, it wasn't me actually who arrived, it was a veterinarian I worked with. And when she got there, she could see that clearly whatever was going on in that home and in those people's lives wasn't a great situation. And Gracie had been locked in a closet for 3 months with her food and her litter and water. And so the veterinarian said, is there any way that you would allow me to take her and see if I can kind of rehabilitate her? And so she brought her back to the clinic, and I immediately said, okay, I'm going to take this little soul. And she's not vicious at all. She's the nicest little girl. And so she's really come out of her shell. I also have horses. I have 2 horses. My one horse is Gabrielle, is her name, and she's going to be 26. And I've had her since she was 1. I kept her all through when I went to
Oh
school,
my
when I had my
gosh.
children. She's just my very best friend. And then a year and a half ago or 2 years ago, I adopted a 16-year-old Dutch harness. He belonged to the Mennonites.
Oh wow.
And he came and he was about 250 pounds underweight, and he was just
Oh.
covered in scars. And so I don't know all his story, but he's come into our home and joined the group, and he's come a long, long way. And so, yeah, I've got a house full of seniors. I've got a bunch of chickens. I've got a duck and 2 teenagers.
That's awesome. You have a full house. But
yes.
no,
Too.
I love that. And I love the idea of like taking in the seniors, just, they're They're not the ones that everyone jumps straight to, but they're the ones that, like, need love the most, you know?
Absolutely.
Oh, it's heartbreaking.
It
So
is. And you're so right that they are so grateful. Like animals definitely feel gratitude, and particularly those seniors who, at the final phase of their life have come to a point where they don't have a home. And yeah, I'm really passionate about it. I'll always adopt seniors.
let's talk about what your average week looks like as far as like trying to make time, with your business and with scheduling, hobbies, time with family. How do you juggle all that?
Juggle is a great term.
Yeah.
Um, yeah, it is very busy. So, like, I have a farm, and so I do barn chores twice a day. Yeah, it is a lot, but I love it. It brings me a lot of joy. And so I would say that my average work week is somewhere between 50 and 60 hours if I'm not preparing for a workshop. And so typically in the mornings, I deal with all the emails. If I have any customer support that needs to happen with our on demand training. From there, I try to have my meetings before lunch when I can so that my afternoon can focus on providing virtual training, continuing to develop content. I also have some vet clinics that contract my services for in-home euthanasia. And so, yeah, there's days where I'm off providing in-home euthanasia services as well. And I love to garden. I love to fish. I love to forage. I like to can. So my children, who are actually 21 and 18, so I guess they're not really children, they share a lot of those passions as well. So they do help me. They help with the barn chores, and we do a lot of that stuff together. It's how we spend a lot of our family time. And so it's definitely busy. Running your own business is
Mhm.
not easier
Right.
than working for somebody else. That is
Mhm.
for sure. But it's so rewarding that I wouldn't have it any other way.
Can you share your journey from working in a clinic to when you started your own business? Like what did that time look like for you when you decided to go that route?
Absolutely. So I decided that I wanted to start a business while I was still working for the hospice center. And really, kind of what motivated me to do that is that as I was going into these families' homes and providing hospice care and end of life care euthanasia services, I was overwhelmed by the amount of families that shared with me that no one had ever taught them anything about identifying comfort in their pet, recognizing chronic pain. No one in their veterinary team had ever talked to them about quality of life and how to monitor that and what that looks like. And it was really heartbreaking because these families clearly felt unguided and alone in this journey that is the final chapter of a pet's life. And so I thought, you know what? Working at a hospice center, I can help 4 or 5 families a day. And I trained all the new team members, veterinarians, RVTs, client care representatives. So I was able to kind of expand care, access to care that way. But I recognized that if I was really going to make a difference in the lives of these pets and the families who love them, I needed to develop some type of a training system where I could teach other veterinary teams how to address the final life stage, which is so often forgotten. In fact, I often refer to it as the forgotten life stage because we tailor our care as veterinary teams and clinics. We pride ourselves in tailoring our care to the life stages: puppy and kitten, wellness, and then the senior life stage. But when it comes to that final life stage, which arguably requires the most care, guidance, and support, nobody's doing it. There's no tailored care. It's just like we're going to extend our senior program, and it doesn't work like that. And so it was through that experience that I started to develop training content. And then from there, I recognized that if I'm going to really be successful, I can no longer work full time in a hospice center. And so I started connecting with clinics about contracting out my euthanasia services to supplement my income. And that allowed me to really pour my heart and my time and my effort into developing the art of goodbye.
Yeah, that's amazing. I kind of want to I want to get a little bit into this kind of subject here. I want to just talk about my own experience. So I had been working in the field for, gosh, well over 10 years at this point. And I think it was in about 2018 is when I found out my 8-year-old golden retriever got hemangiosarcoma. And
Oh,
I had obviously known what it was. I knew it was bad, and I had done the surgery. He survived the surgery, and then it came back as malignant. And that whole journey of hospice care, I think it was only a couple months. He only survived a couple months. But the hospice care from the moment he had the surgery to the moment he died was the most alone I had ever felt in my entire life.
Oh.
And that was as a veterinary professional. That was as someone who sees euthanasias all the time, who deals with the end of life discussions all the time. That was somebody who is in it. And I remember I did not really have a lot of support as far as even just like clinging on to like, what can I do to keep him comfortable? What can I do to prolong his life, other than chemo? And then of course, I'm sure you're familiar with the type of chemo with hemangiosarcoma, and that's hard on them. And there's just so many things and there were so many questions I had. And a lot of like the veterinary professionals, they were just like, you know how it goes. Like, he's going to die eventually. And it was just very like harsh. And and even like that, I learned a lot in that, um, of just like how sometimes cold-hearted we can be on that end of life stage, but when it's your pet, it's different. And so, yeah, that was the toughest time for me. And now when I see people who come in with hemangiosarcoma patients, like I sit there with them and I go over everything with them and I say, there's not really a right answer, but I really sit in that with them. And it's so I think about how hard it was for me. I can't even imagine how difficult it is for people who have no experience in the veterinary field, who have no experience with these type of diseases. And so I completely 100% agree with you on how important it is. And like the fact that we don't focus on it is really disheartening and it's really sad. It just makes like they're confused. They don't know. And how many times too I've seen where they come in and they just want to be told that they're doing the right thing.
Yes.
They just want to know because they don't know. They don't know. And like sometimes I've had doctors who are kind of irritated when I'm like, they just want to have this conversation with you. And they're like, well, I can't tell them what to do. And it's like, we know that. We know that you can't tell them what to do. But they need reassurance. They need to know that they're doing the right thing, because if they don't think that they're doing the right thing, then they're going to be hard on themselves for a very long time, if not the rest of their lives.
Absolutely. And you are just so accurate in saying that it is it is widespread that veterinary teams and veterinarians are reluctant to have the conversation about euthanasia. And so I would never pressure a family. It's their decision.
Mhm,
And in fact, one of the most important things about hospice care, one of the lessons that took me the longest to learn was how to remain non-judgmental
mhm,
when a family would euthanize sooner than I would have or later than I would have, and how to learn to understand that we all have budgets. And I'm not just talking finances, I'm talking your time budget. If you work 12-hour shifts and you commute and your cat's been diagnosed with diabetes and you're electing for end of life care, would that be my first choice? No. But if you know there's absolutely no way you'll ever regulate that blood sugar, maybe you have a swing shift, we don't have a right to judge you. If
right,
we can't offer you a solution, we have no right to judge.
right.
And so that is a big part of it. And we should be, so outside of that, when we're talking about true hospice cases like cancer and so many heart disease, we should be the first person to bring up end of life care because families feel ashamed to even suggest to us, because they think, well, if the team thought that I should euthanize, they would say it, and we're not saying it. And again, we don't need to say, hey, it's time for you to euthanize, but we can say, I think it's important that we talk about end of life care and what that's going to look like. And what are some lines in the sand that your family has that when you get there, you'll know it's time. And so we definitely need to do a lot more of that. And we also need to shift our focus. When we are in all other life stages, our focus is on extending life. Okay, like a treatment plan. The focus of a treatment plan is to extend that patient's life for as long as possible. When we get to that palliative hospice phase of that patient's life, so the last 8 months or less of their life, the focus shifts to quality of life over quantity of time. Comfort is king. So we actually get rid of that treatment plan, we discontinue it, and instead we start a comfort care plan. And that comfort care plan takes into account the patient's psychological well-being. And so, like you said about your golden, if you had have gone and done that chemo, that would have been very stressful on that little soul. Everyone is different. Some patients tolerate it well, and that's ultimately their family's decision. They know them best. But for patients like little cats that are really nervous in that, are we actually improving that patient's quality of life when we are forcing that family to do continual testing and surgery and chemo and all of that when really all they want is to keep their pet comfortable for as long as possible? And so, yeah, we really can do a lot better than we're doing now. And my hope is that as a profession, that we all begin to recognize that and start tailoring care to that final life stage to take that into account.
Yeah. Yeah. And I think too, if there are any pet parents that are listening who don't work in the veterinary field, I just want to say too, like if you're going through something like that and you choose not to do chemo, I know there's no judgment from me. uh, I did feel a little bit judged by some of my coworkers that I did not go the chemo route because they were like, "Well, you have access to it. You have a discount. Like, why wouldn't you do that?" And my decision was his overall comfort over just prolonging his life. I wanted him to be a normal dog for as long as he could. And I knew the prognosis of hemangiosarcoma even with chemo and with all that stuff. And my ultimate goal for him was to just be comfortable until he decided that it was time for him to go. And that's what he did, and I don't regret it. But I do think sometimes even too, like pet owners may think that, we are judging them if they don't decide to go the chemo route. But again, we all make those decisions based off of finances, based off of how comfortable we want our pets to be, and things of that nature. So like you said, it's also very important to not be judgmental in those circumstances because they're already having a hard time making these decisions, let alone trying to make these decisions and feeling like they're being judged for them as well.
Absolutely. And we need to remember too, as professionals, that yes, we are the professional, but nobody knows that pet like the pet parent.
Right.
Like, and yeah, encouraging families to do something where that pet parent knows that the pet is gonna dread it.
Right.
And so actually another example of that is say a small dog or a cat that hates to be pilled. Okay. They do not take them, they spit them out. And as a veterinary team, we've said, okay, the veterinarian has said there's 2 pills twice a day that you need to give. Okay. And if that family is saying, I'm really struggling, I can't do that, we should not be making them feel guilty like, well, if you don't do that, you're not doing a good job. And instead, in that situation, suggesting compounded medications. If they can't afford that, prioritize medications. If you can only get one medication in and you have heart disease, it's always going to be furosemide because
Mhm.
it's the one that increases your quality of life. And so, even just things like that, we say in hospice care that the patient should be a willing participant
Mhm.
in the comfort care plan because when they're not only does it decrease their quality of life, but it decreases the pet parent's quality of life as well
Oh
because
yeah.
they have to force their pet to do something they know that they hate. And that's not fair for anybody.
Yeah. And it's just a lot too on the pet parent. I mean, I remember, like I said, when I was going through the whole hemangiosarcoma thing and like, and trying to, supplement and do all these things. And I just remember like, ugh, it's a lot of energy and it's a lot of emotion and it's exhausting. And like the pet parent is taking care of the pet, but who's taking care of the pet parent? So that's why it's so great and it's so important. And I guess with this conversation, I'm just really trying to, get it down like why what you're doing is so, so, so important for these pet parents because it really does make a huge difference at the end of it all because it's so hard. It's so difficult.
It is so difficult. And like the other thing I'll say before we move on is there is a study, and it was done by AHA, and they asked 800,000 around pet parents um, if they saw their veterinarian in the last 18 months of their pet's life. And 50% of cat owners and 45% of dog owners said no. And these are people who had historically been bringing their pets into the clinic to see the vet. And once I heard that statistic, I started asking families I was interacting with, when's the last time you saw your veterinarian? Why? Why haven't you seen your veterinarian? And some of the feedback that I have received consistently is that I felt judged. I felt forced to continue testing. They weren't going to give me pain meds if I didn't do blood work. Things like that. If I didn't do the surgery, I was made to feel like a bad pet parent. And it might not even be that care provider's intention to make that family feel guilty, but we're not always mindful of our wording, that we need to
Mhm.
stop being clinical and we need to come from a different angle. And so not only does it benefit the pet parent and the pet, but it actually benefits us as a clinic too, because it's
Right.
going to increase client satisfaction and as a result, retention.
Emily, what do you think are the main reasons for the current technician shortage in the veterinary field today?
I think that is a really multifaceted issue that we have going on in our industry. I think that one of the main reasons is the fact that we are not being paid a living wage, even though we are putting our blood, sweat, and tears into that practice and into supporting patients and families. A lot of us, especially for single people, they can barely pay their bills,
Yeah.
and that's not right. We contribute in a really big way. The clinic couldn't run without us. And so I think one of the areas is that we're just not making a living wage. We're not being paid fairly, compensated fairly. I think another reason, in my humble opinion, is that there there is a misconception, and in fact, I say it's my humble opinion, but I've actually found research on it, and I don't know the name of this study, but I'll give it to you. And it's actually been shared in research that I had published. So as I was going through and looking through all this research about RVTs and why we should be playing a leadership role in hospice care, I discovered that there are studies that show that there is a huge misconception among veterinarians about RVTs, LVTs, licensed veterinary technicians of all walks, about what our capabilities actually are and what our scope of practice actually is. And
Right.
so oftentimes we're treated as support staff. And although we are happy to support the team, of course we do, we are licensed medical professionals and we should be mobilized as such. And so, again, I think when we're not mobilized to our full extent and we feel like we're kind of being held back and put into this little box, our job fulfillment goes way down. And so I think that that's probably the other biggest factor. And honestly, I think the third factor is that for some reason in our industry, there seems to be a bit of an epidemic with toxic work culture.
Mm.
And
Yep.
I'm not saying every team, because as I've gotten to kind of meet teams from around the world and support them, I have met some really incredible teams that when I can talk to them, I can feel that you guys are just like the A team. You guys respect each other. You use team based collaborative care. But then I talk to other teams and I can feel it. Like people are drained, they're not happy, they're not engaged. And so I think it's something we're starting to address now and we're focusing on improving that. But unfortunately, it's still a big part of our industry.
I don't know if you're any of those tech groups, but me and Jen see it all the time. There's a lot of techs who are like a toxic clinic, toxic clinic. I've always said I've been very fortunate in my life. All my clinics were very lovely, but it's a huge problem. And we need to, I feel like a lot of us, we aren't built for the clinic lifestyle. And if we can find something just a tad on the outskirts of it, we can do that too. And something like what you're providing can help with that.
Yeah, I sure hope so.
Yes. So, how can your line of work help address some of these challenges?
Well, I think that it can help address some of these challenges by empowering RVTs to take on a leadership role in hospice care. And so, really teaching them how to provide families with that education, tools, and resources to help support and guide them as they navigate that final chapter of their pet's life. Also, by supporting and educating the veterinarians and the team to see that this is a life stage that we should be embracing, and that when a veterinary technician takes the lead as the comfort care coordinator, they are not trying to be a veterinarian. They are actually still working well within their scope, and instead they're trying to support that veterinarian who is far too busy to do the hand holding that families require when their pet is terminally ill and dying. And so the reality is, the vast majority of patients that are hospice patients, they already have a diagnosis, a prognosis, and prescriptions. So we don't have to worry that the veterinarian or the veterinary technician is going rogue. We're not doing that. We have no desire to do that. But what we can do is we can make sure patients don't fall through the cracks, that they're receiving regular follow ups and pain assessments and rechecks and quality of life consults. And that when they face challenges with providing care and caregiver burden, we can help them navigate that. We're good at it. And so I think that by providing that training and that education to teams as a whole, it can really help elevate the role of the RVT in that practice and maybe even inspire them to do something outside of practice where they can support senior pets through things like what you do, Michelle, and your
Yes.
business does. And so, yeah, that's my hope is that through those modalities, I can help.
Yes. And in my line of work, I see it too often where I can tell that pet is arthritic, that pet is painful, that pet is not comfortable. That 17-year-old cat that sleeps all day isn't just old, it's also painful. And I try to get my clients to see their veterinarian. I try to be like, man, I would love some aspirin if I was like a 17-year-old cat. Like there's some pain management that your veterinarian can recommend for for Fluffy. And I unfortunately will say I've gotten a lot of pushback from a lot of clients in my area about end of life comfort. Like even if we don't have a diagnosis, it's just, oh, well, we're just getting old. And I'm like, well, we're not just getting old. I'm like, we're also getting painful. And I could see your dog's hips laying out on the floor. I think we should get some help. And I struggle with that personally because I'm seeing them and they know I'm educated. They know like I have no financial gain from them going to a veterinary clinic. So within myself, I almost take it as a personal like hit a little bit when my clients don't listen to me and I see these pets in pain. And
Yeah.
I'm like, come on, you take an aspirin every couple of days, right? Like your back hurts, your knees hurt, your hips hurt. Your pet is the same. They just can't tell you. So go to the vet. Just go. So I want to see more of this out there so we can get these pets care, whether it's, going to the vet or having somebody like us come in and administer medications and do, like you said, like bringing the pet care to them directly would be. Oh, I'd love to see that more. Yes.
Absolutely. And honestly, something that I'm really passionate about in hospice care as well is providing care virtually. And so it can work again, we collaborate, right, as professionals. And so it could look like someone like yourself going into the home, having a virtual call with the veterinarian. So the veterinarian can see the patient, they can see the environment, make environmental modification recommendations, and you can then go through, give a pain score, or as we kind of discussed a little bit earlier, give that family that chronic pain scale and let them give a score. Because I have found that it's much easier to get them on board, recognizing that their pet is in fact painful when they are themselves the one who tick those boxes and say, oh, wait, I think you're right. But certainly virtual care is such a valuable tool in hospice care, rechecks, pain assessments, even quality of life consults can and should be done virtually. We know that stress impacts the immune system. So when you have a patient that's already been diagnosed with a terminal illness, there are very few reasons that justify him actually coming into the building where he has to be loaded into a car when he's arthritic and painful. Now he's having mobility setbacks. And actually, I worked with a team called Tell My Vet, and they are a lovely team. And we developed one of the world's first virtual platforms to provide hospice care. So
Okay.
veterinary teams can use it and they
Okay.
sign up, and it has all of the tools and resources that your team requires to streamline the process. So they can book a virtual consult right on your website. You get to set your availability. You can change it whenever you want. And you get to decide what consult. So a pain assessment, a quality of life consult, a recheck, something like that. And then every resource, pain scales, quality of life scales, different modalities like help them up harnesses, they are all in this virtual ecosystem, and they get sent to that family along with a dedicated questionnaire as soon as they book that appointment. So they're going to fill out all of this information. So when you start that consult, you can work through it with them and help support them in that journey. And so, yeah, in home care is great, virtual care is great, and having hospice patients come into the clinic only when necessary is the ideal approach.
What's the name of that one again? I didn't catch it. The
Yes.
virtual platform?
It's called Tell My Vet.
Tell My Vet. Okay.
Tell My Vet. Oh, I'm willing to start that offer as of the launch of this podcast, the airing of this podcast. And I will honor that until January of next year. So January 2027. So between now and then, if your team decides that maybe you live rurally, maybe you're a rural clinic and it's hard for people to get into the clinic, that you are more than welcome to enjoy this virtual hospice platform for 1 year without paying any subscription fee.
That's
Awesome.
amazing.
Thank you, Emily.
Thank you.
You're welcome. You're
Yes.
Yeah.
welcome.
As you hear that, everybody, do that.
Yeah.
Do it.
Um, I guess I have like a little extra question in between that. So you're the founder and you're the owner of the Art of Goodbye. Do you have like employees that also go out and train other clinics, or is it mostly just you? And like, how are these clinics? Are they getting a hold of you, or are you kind of like advertising yourself? Like, how much interest are you really getting from other clinics in this hospice interest?
Absolutely. So as training is concerned, I am currently the only employee that provides training, but I do have employees that help with tech support, they help with client care.
Okay.
I also have team members that will come and support workshops. So they will, like event coordinators. However, I have just recently collaborated with a veterinarian, Dr. Amir Shannon, who is the founder of the International Association of Animal Hospice and Palliative Care, and just such a wonderful soul. I feel so honored to have collaborated with him. And so he is going to be joining the Art of Goodbye for 3-day workshops, and he's going to be providing training alongside myself to veterinarians and their teams. And so, as far as the interest is concerned, like any business, word of mouth takes a little while to get
Mm-hmm.
going.
Yep.
And so out of the gate, I would be reaching out to clinics and telling them about myself, marketing on LinkedIn, sending out flyers. And so I still do a lot of that, but it has really been picking up where teams reach out to me now and say, I heard about you through a colleague. I was at a vet clinic and I saw that they had received your training and they were really happy with the improvements that they had and that they saw when caring for hospice and terminally ill patients. And then I've actually had a lot of like conferences reach out. I had people from Australia, like New Zealand. I've been fortunate enough now to do talks like all over the world, and it's continuing to grow all the time. And I hope it continues to do that because the more it grows, the more families and patients that we can help.
Yeah. Oh my gosh, that's so awesome. I love that.
Yes.
Yeah. I love that this is definitely starting to be talked about more, and hopefully that this will be implemented more in clinics. I mean, I can honestly say in every single clinic I've ever worked for, this was just never really a huge topic. It was not even really something that was even thought about. So, yeah, no, I love that clinics are actually starting to get an interest. Do you get any clinics from the US, or is it just from the UK right now that you're working with?
So I live in Canada,
Mhm.
but
Oh, I'm so sorry.
that's okay.
Canada.
I actually have clinics in the UK that I work with as well.
Oh, okay.
There's a veterinarian that we have a little collaboration scheduled. I'm hoping to fly my team to the UK and do a workshop there. And I think
Oh,
in 2027 we might go to Australia and have a workshop there. So
oh my gosh, so fun.
lots of things on the go, and things that we're working towards. But yeah, clinics are starting to recognize, families are starting to insist, right? They are starting to get to the point where they say that this is my family member and I want my family member to receive dedicated palliative and hospice support in their final phase of life. And the other truth that we sometimes forget is that palliative and hospice care generates a lot of revenue.
Yeah,
Okay, so it really benefits everyone. And I would say that the average, from the numbers that I have crunched from the teams I've supported, the average veterinary team that implements a dedicated comfort care program in their clinic, if they have 3 veterinarians, so I did the math for a 3 veterinarian practice, they can generate somewhere between $200,000 and $250,000 a year of additional revenue.
wow.
In fact, when I was working in hospice care and seeing my own patients all day, every day, I generated double that for that clinic that I worked for. So not only are we supporting families better, we're reducing patient suffering, we're reducing compassion fatigue as well. And that's
Yeah.
something we haven't talked about. When we're not supporting pet parents with a comfort centered lens, in that final phase, it's hard for us too, because we see the families that are struggling. We see the patients that are suffering. It increases our risk for compassion fatigue. So when we provide this guidance and support and we see how grateful families are, we actually get to experience compassion satisfaction. And that fills our cup. There's just so many reasons why we kind of should be doing it, and teams are starting to catch on, which is really exciting.
What aspect of your work are you most passionate about, and how do you keep that passion alive? Is there anything else that you can add, with everything else that you've talked about?
Uh, The area of my work that I'm most passionate about is definitely reducing suffering. And so reducing patient suffering when we educate the caregiver, but also reducing that family's suffering when they feel supported. Of course, they're still going to be upset, but when they feel that we actually hear them and we're meeting them where they're at and we're going to help guide them and do some hand holding, we reduce their suffering and they get to heal faster.
Mm.
And so that's definitely the part of my work that I'm the most passionate about, is reducing suffering.
Yeah. No,
Yeah.
yeah, I feel like that's the biggest part. And I remember I've had so many people, which I'm sure you guys have too, where they say all the time like, "Oh, I don't know how you do this. It's so hard. I love animals so much. Like euthanasia must be so hard on you guys." And I still to this day will tell people, and I'm like, honestly, euthanasia is not the most difficult thing. It's watching our patients suffer. That is
Yes.
the most difficult thing. And that has always been the most difficult thing. I will say, I work in a lot of emergency hospitals where they basically internal medicine specialties are in the same building. And I always say kudos to internal medicine specialists and to their technicians because the amount of hard cases that they have to see. They see a lot of oncology cases. And I remember I worked at an emergency clinic where we took care a lot of like overnight internal medicine patients. And those were the most difficult cases for me to take care of because there's a lot of suffering that goes on in those cases and it's hard and it's and I work in emergency and ICU. So and obviously I see patients suffer, but I think, the difference sometimes between emergency and ICU is those aren't necessarily chronic cases. So it's when you see those chronic cases and they keep coming back and, they're not getting better. Oh, those are just the ones that always stick with me and that I'll always remember. And that those were the ones that I would go home and I would cry and I would hope, oh my gosh. And I hope pet parents don't think that this is the worst thing in the world, but sometimes I would just hope that they would make the decisions for themselves, those animals, and that I would not have to see them the next day and have to do it all over again. And I would just you know, just be like, oh, please, please, please. Like, yeah, it just is hard.
And that's so fair. And honestly, I think we've all felt that way at times. And that again feeds back to why it's so important for us as veterinary professionals to have hospice training
Right.
so that we can help that family, not pressure them, but we can provide them with those tools and education so that they do recognize that the kindest thing in this situation is to say goodbye because your sweet pea is not getting any better and they have crossed into the area of suffering.
Mhm.
And I know that you don't want them to suffer. And so, again, it's just so important that we are able to have these conversations in a way that's compassionate and supportive. And it really does help reduce those situations where, the family hasn't had anybody have a real conversation about this phase of their life and what to expect in 3 weeks, 3 months, things like that, so that families do make that decision for their pet when they're empowered.
Yeah, I wonder if that's something that if there's any classes in veterinary school that they focus on. Do you know? I mean, I don't think that I don't remember in technician school learning
Not mine.
anything about hospice or
Oh,
of having those type of conversations of end of life quality care or anything like that. So I'm curious, do we know if veterinarians get any of that type of training in school?
To the best of my knowledge, now I'm sure that there is a school somewhere in the world that provides some training, maybe half an hour. Part of what I do is I actually go to schools and I speak to veterinarians and I speak to
Okay.
technician students about hospice care. In fact, I've just been invited to the University of Guelph, which is a really well known veterinary school here in Canada. And I'm going
Okay.
to be going to speak to the students and provide some hospice training because the reality is we do not teach our professionals about addressing that final life stage. And I know that there's so much to learn about saving pets, and I appreciate that. However, these are really difficult conversations for
yes.
us as professionals, and we need more support and we need more education and training so that we can do it effectively. But to the best of my knowledge, I don't know a single school that I have ever come across that actually has a dedicated hospice and palliative care section to their program.
Hey everyone, it's Jen from Endless Journeys, the VetTech Odyssey podcast. We wanted to let you know that our first episode turned out to be a bit longer than we expected. After receiving some valuable feedback, we decided it would be best to break it into 2 parts to make it more digestible and enjoyable for you guys. We're excited to share that both part 1 and part 2 are available today, so you can dive right into the full conversation at your own pace. We really appreciate your support, and we hope you enjoy both parts of this episode. Thank you so much for tuning in to Endless Journeys, the VetTech Odyssey podcast. We hope you enjoyed today's episode and found some valuable insights. If you did, be sure to subscribe so you never miss an episode. We'd love to hear your thoughts, so please leave us a review and let us know what you think. You can also connect with us on all social media platforms at Endless Journeys, the VetTech Odyssey podcast. Until next time, keep learning, keep growing, and keep making a positive impact in the veterinary world. We need you guys. Have a great day.